listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Thank you guys for tuning in to another episode of Beyond Wellness Radio. In today's show, we are going to be talking about IBS. We're going to be talking about the digestive system. We're going to dive into how to heal your gut, because that is the center of everything when it comes to health. Because if you're not digesting your food, if you're not pulling in your nutrients, it doesn't matter how good your diet is. So how's it going today, Dr. Justin?
Barris, it's going great. How are you doing today?
I'm doing very well.
Excellent.
So, first question, since we're talking about digestion, let's talk about breakfast. What did you eat this morning?
So today for breakfast, I did 4 pasture-fed eggs, Rocky style, along with some high-quality whey protein and some collagen, and I did a little bit of bulletproof coffee and butter, and some MCT oil all blended up, and it was magnificent.
That sounds really good.
How about you, Barris? What'd you have?
Well, I'm giving my digestive system a break. I'm probably boring people because this is the second time that I just fasted, and it's just like nothing. Some water. Yeah.
Nice.
But so you said Rocky style. I'm going to tell the people, when I stayed over at Dr. Justin's house for Paleo FX, like, he's serious when he says he could do a Rocky style, like throw it in a cup if he needs to and just throw back the eggs without me. Like, I at least need to shake it, put it in a shaker cup just to emulsify it. You know what I mean? Just so I don't have the consistency. It's more of a texture thing, but really you can't even taste it after you shake it or you blend it up. It's more of just if you ever throw eggs in a smoothie, it's just like throwing a banana in a smoothie or avocado. It just makes it thicker.
Exactly. I've been doing this for about 10 years, and I do not recommend doing it with low-quality eggs. Always use high-quality eggs if you're going to do it that way. Just a disclaimer for all of our listeners here.
Oh, yeah. Don't use raw, gross eggs. Use high-quality eggs. Wash the shells, right?
Absolutely.
Yeah. Make sure your eggs are more of a closer to orange than they are yellow.
Yes, exactly.
Mm-hmm. So, for our listeners listening out there, I mean, there's a lot of broad issues when it comes to the digestive system, and we're going to focus on kind of one today, just as IBS. So for people that don't know, could you please explain a little bit about the digestive system, kind of like as a intro, and then go into IBS just a bit, Dr. Justin?
Sure. So the first part, so we look at our digestive system. The first part of our GI system is actually going to be our mouth, right? So we want to make sure we chew our food. We actually start activating and producing enzymes in our mouth known as amylase. So we're already starting the carbohydrate breakdown in our mouth. And also chewing food is really important because it breaks the food up. And this is important because it creates more surface area, so all of the enzymes and the acids and the bile salts have greater ability to contact it. So big chunks of food makes it really hard on your GI system. So there's an old Buddhist proverb that goes something like this: drink your food and chew your water. So what that really means is chew your food up to a consistency that it's somewhat liquid. And when you drink your water, literally just let it permeate your mouth for a few seconds so your saliva imprints on it, so that when you take it in, you absorb it better. So that's kind of the first step of digestion, is really making sure you chew up your food well. The next step is going to occur in your stomach, and your stomach's really important because that's where hydrochloric acid is produced. Hydrochloric acid, go ahead.
Can I cut you off real quick?
Yeah.
Not to get too hysteric, but could we say that there's a step maybe even before chewing, maybe even when you're thinking about your food? Because there's been times that I've walked past a room and I smelled like barbecue, and my mouth I'd start to salivate, just like, ooh, seems tasty, so that could be important too. Like, I notice, like, when I cook my own food, that I enjoy it better because maybe I have that process of kind of digestion and eating before I'm even eating versus just going through fast food and or whatnot?
Yeah, so that's actually known as the cephalic phase of digestion. So you smell that smell, you start producing saliva, your tummy starts already producing gastrin and is starting to get ready. That vagus nerve is activated. So your vagus nerve is the nerve that comes down from your brain, from your brainstem, and it basically tells your body to rest and relax. So that's one of the big first things that needs to happen is that cephalic phase of digestion, or it's you smell that really good, those ribs or those French fries by McDonald's. Everyone knows that the French fry smell by McDonald's, and you start feeling that sense. And that's really important because if you're really stressed out and you're in this fight or flight state, or we call it our sympathetic nervous system is really activated, that's going to shut down that cephalic phase of digestion. That's going to shut down our vagus nerve coming in and getting our stomach kind of pre-gamed or kind of getting it loosened up. So imagine that phase of digestion is kind of doing maybe a little bit of exercises to get loose for your competition, so to speak. And if we're super stressed out, then we go into our competition or we go into our eating kind of stiff, if you will.
Yeah. So make sure you're happy when you eat and you enjoy your food. Okay, perfect. Okay, back to second/third stage, which is after we chew our food, which would kind of be part two, and then down onto the stomach. What happens there? You mentioned the hydrochloric acid, some of the bile salts. And then what else?
Yeah, so when we eat our food, it goes into our stomach. One of the first things that happens is we secrete hydrochloric acid. Does a couple of things. It activates protein digesting enzymes. All right, these protein digesting enzymes known as pepsin, and they just start the protein breakdown process. HCl is also really important because it's an acid. So if you know your pH scale, right, on the 1 to 2 to 3 side, that's more acidic. So we want our tummy to be about a pH of 2. And as we deviate more alkaline, 3, 4, 5, that's not going to be the best thing for our digestive tract because as we move away from that acidic pH, it's going to increase the chance of bacterial overgrowth in the stomach. And we actually need hydrochloric acid to help tighten that cardiac sphincter, which is the sphincter on the very top of the stomach that goes up into the esophagus. So if we don't have enough HCl, we're not going to have that clamp down reflux on top of our esophagus, and that will allow more acid to rise up. So it's this delicate balance. We need enough HCl to come in there to clamp down the esophageal sphincter. Also, HCl is an important stimulator of our pyloric glands to produce mucus, and mucus actually helps protect the gastric mucosa from the acidity. So if we don't have this delicate balance of HCl secretion, it's easy to see that we start having a lack of protein digestion. We start having a lack of mucus secretion to protect our tummy. We start having a higher pH, which is going to cause more bacterial overgrowth. We're going to have patency in that esophageal sphincter. What that means is that's going to get loose, and we're going to have indigestion, and acids will rise up and burn the esophagus. So you can see there's this delicate domino effect that needs to happen. And if it doesn't happen properly, a whole host of GI issues start occurring. And it all starts in the stomach and then starts dominoing from the stomach into the small intestine. Any questions at that point so far, Barris?
Yeah, so I just want to break it down for the listeners. You mentioned the fact that we need enough hydrochloric acid in order to keep that sphincter up back to our esophagus kind of clamped down. So what you're saying is if we don't have enough, this can cause things like acid reflux, correct?
Yeah, and this is one of these things that just sounds so contradictory because people are like, wait a minute, acid actually helps with digestion and it's not too much of an acid. So this is the common myth that's out there. So we already kind of talked about the vagus nerve kind of activating our parasympathetics, which is like our rest and digest. And we have the sympathetic nervous system that activates fight or flight. So when we're in that fight or flight type of system, guess where all of our blood flow goes, Barris?
Goes out to our limbs because we need to run from something.
Yeah, we got to mobilize glucose. We got to get our epinephrine and our adrenaline going. We got to run, punch, fight, flee, do whatever we got to do to survive. And so if our blood is at our extremities and our hands and feet, guess where it's not?
Not in our gut. Why do I need to digest or make babies if I'm running from a lion?
Exactly. So most people, Like prehistorically, it was like running from a lion, but now like being stuck in traffic, that's like a little lion that you have to run from.
Isn't that kind of where like the phrase like scared the shit out of you comes from?
Yeah, exactly. Because you get super scared, you like pee your pants or you crap yourself because your body is like, all right, we need to just get everything away from the center and we need to mobilize and fight and flight.
Yeah. Hmm.
So your body is just not caring about digestion. So really important when that happens, the blood needs to be in the tummy area to digest. I mean, everyone probably can think of like they ate a big meal and then they went and they started exercising and they got sick.
Yeah.
Why?
Hmm.
Because the blood left the intestinal tract and the food sat there and created a nauseating type of effect because it was just sitting there and basically rotting and fermenting and putrefying and you got sick. I think that's where the analogy, if you eat a meal, you should wait 2 hours or you'll drown or something, right? I think that old wives' tale was kind of from that type of thing there. So again, we need stomach acid, and we do have an acidic effect if we don't digest food properly. It's not the acidic effect we're thinking of. What happens is the food literally sits inside your stomach and rots, and then it ferments, meaning the carbohydrates kind of ferment and rot, the protein putrefies, the fat rancidifies, and it rots. And from that rotting comes up organic acids. And then also from there, that higher pH, right, because we don't have the good gastric secretions, that pH creeps up a little higher, and that allows more of a dysbiotic overgrowth. And when that overgrowth happens, we increase our interabdominal pressure. So how many people can think of the fact that they may feel bloated after a meal? Let's increase interabdominal pressure. And guess what the increased interabdominal pressure does, Barris?
That can also throw off your skeletal muscle position. That's going to be pushing on your gut. That can throw off your hips. I've seen that with clients that kind of have a that belly stuck out, and they might not even be that. I've seen people that have a six pack, but their belly sticks out.
Yeah, exactly. It looks like they have like a little, almost like a food baby, if you will.
Yeah, exactly.
Yeah. So what happens is that interabdominal pressure, that actually opens up the esophageal sphincter as well. So again, not enough HCl, that opens up the esophageal sphincter. Not enough, too much interabdominal pressure, that opens up the esophageal sphincter. And then that stomach acid can rise up and be a problem. Now, a lot of times there's an H. pylori issue too, because H. pylori is a common infection that can actually come in there, and it creates an enzyme called urease, which then breaks down some of the nitrogen in the gut from the protein into ammonia. And ammonia has a 11 number for the pH scale, which is very, very alkaline. So that will actually neutralize someone's stomach acid too. So a lot of information, but recapping that, H. pylori creates enzymes that lower stomach acid, which creates digestion problems. And then the next thing on top of that is I see a lot of people with autoimmune thyroid issues, and there's a strong connection in the literature between autoimmune thyroid and low B12. And it's not that people aren't consuming it. A lot of times there's an autoimmune attack against the parietal cells. And this is where it gets really interesting, and I'm hoping I'm not going over people's heads. We'll kind of break it down and make sense of it again.
Yeah, but that's why I'm here. Anytime you start to go too far out there, I'm kind of like that middleman that out here. I'm like, you know what? Everybody might not know that. Let me make sure that
if I go too far, you just pull out the whip and you just crack it a few times, and I'll slow down for you, okay? So again, those parietal cells, the cool thing is these parietal cells produce hydrochloric acid, but they also produce a compound known as intrinsic factor, which is needed to absorb B12. So we have a great deal of population out there that have Hashimoto's and autoimmune conditions, and the connection is autoimmune condition in the thyroid is a potential for autoimmune condition in the gut, which then can affect stomach acid and can affect B12 absorption. And then low B12 can weaken your immune system and lower energy as well. So I'll kind of just give you a chance to kind of recap or kind of ask any questions, Barris.
Yeah. So I'm going to bring back kind of this myth that I hear all the time, and it frustrates me sometimes. And it's about your food. Well, of course your food's going to affect your body, but basically the acidity of the food's ash the acid alkaline ash that a food has onto your body. And in my head, I always tell people, like, if I burn a food, like that, my body's not a Bunsen burner. There's different chemical reactions that's going to happen, and there's different levels of acidity and alkalinity throughout the intestinal tract. So could you kind of go a little bit into that myth, just real quick? I don't want to go into the tangent too far, but people are going to bring up, well, you need to eat an alkaline diet. And there's, of course, eating green foods are going to be beneficial. So when people look at the studies, like, oh, of course, eating vegetables is good for you. But to say that eating meat because it's acidic ash is going to mess up your kidneys and and give you cancer, like, could you please just kill that myth for me?
Yeah, so there's a lot of issues about that. There's scientific studies on both sides of the fence, so we kind of have to break it down and use clinical application or just use real-world examples. So one, when you eat a food, like you said, there's excuse me, Freudian slip. There's an ash that's produced, whether it's alkaline or acidic. So that's pH scale. Again, it's 1 to 14, and it's logarithmic. So there's like, I think, a 10 times. So like a pH of 6 to pH of 7, that's actually a 10 times increase.
Mm-hmm.
So it's not like just a 1-up increase. It's actually a 10-time increase. So when we look at a good pH graph, a pH scale, you're actually going to see that grains are 10 times more acidic than meat. Mm-hmm. So the first thing we have to look at is the recommended food guide pyramid that majority of this country is following. The foundation of that pyramid is grains. So if anyone is really into the whole acid alkaline thing, I am not a whole bunch into that. I look at a lot of acidity issues are really a problem of inflammation, and diet is a big, contributor of that. But again, when we look at that issue, grains are 10 times more acidic than meat. I want to say it's about a 4 to a 4.5, where meat's like a 5 to a 5.5. It depends on the type of grain and type of meat. So you can see right there, grains are 10 times more acidic, and that's the foundation of our food pyramid. Mm-hmm. So that's step one. And most people aren't just eating meat by itself. They're typically eating meats with plants. That's always a good thing. And even if you're ketogenic, you're still going to be consuming high-quality green vegetables that are going to have enough of an alkaline base to it where it's going to kind of, cancel each other out, and you'll be somewhat neutral. Not to mention, in certain foods, there are minerals.
Yeah.
I mean, if you're taking in bone broth, or if you're taking in these various minerals that are in food, or if you're eating some salmon with fish bones in there, or if you're eating some high-quality vegetables that are nutrient dense that may have higher amounts of magnesium in it, or a sweet potato, things like that, these foods are very, very alkaline. So most people, especially in the paleo community, aren't just eating meat by themselves. So there's going to be kind of a canceling out there. But it's important to note that a lot of inflammation in the body actually creates acidity. There are acid byproducts that come from inflammation. So if you're chronically having fatigue, if you have gut infections, if you're eating food that has maybe pesticides or chemicals or artificial hormones in the body like BPA, etc., this could possibly create inflammation in the body, and a natural byproduct of inflammation is going to be acids coming out. Mm-hmm. So that's really important, is that we can have acidity issues just from having chronic inflammation in the body outside of diet alone. And I've tested my pH in the morning via urine during a first morning urination, and I've seen my urine be a little bit more on the acidic side. And one thing that comes up here is I think, well, I would just have a little bit of lemon water or lime water the night before, and it totally corrected it. So it's like, really, like, if a little bit of lime water makes that big of a difference, how important is pH to my overall health? How important is looking at urinary pH to my entire health? And that's where I kind of have an issue, because it's more than just putting a little bit of lime or lemon water in your drink to fix that problem.
Or lemon water is just a miracle cure we never knew about.
Right. I would say personally that the body is dumping out the extra alkalinity from the lemon or lime, and it is essentially dumping it in the urinary tract, and that's what's pushing it back up.
Exactly. I think our kidneys do a very good job of regulating, especially our blood pH, because if our blood pH was thrown off, that'd be very dangerous. So to allow like a simple oh, I'm gonna eat lemon today, and that to throw it into a different direction so greatly that we would change our blood pH. Our bodies are a little bit smarter than that.
Yeah, and essentially when we look at our pH in our blood, it's about a point one kind of range. It's like 7.35 or 7.33 to 7.4-ish. It's a very, very tight, narrow range. And if that goes off, that can mess up all of the enzymatic systems in our body, and we can go into a coma or have some type of serious health issue. So our body has buffering systems, whether it's we're breathing and we produce extra bicarbonate from breathing, from changing our breathing pace, whether it be that we eliminate extra acids in our urinary tract, or whether we pull out various minerals from our bones to help buffer minerals. I mean, there are studies, people look at protein and people say, oh, well, you're pulling out minerals from your bones to buffer that. There really is not any long-term studies on that. And the problem with that is there's also too many cultures like the Maasai that just ate raw milk and meat, which is a very, more on the acidic side, and they still had great health and great dental features. So when you look at some of the works of Weston A. Price and some of the diets that the cultures he studied, it flies in the face, because you still see really good bone structures and really good health in people that are eating diets that are essentially not what I would consider a neutral or alkaline diet.
Yeah, good. Okay, so we're getting off into a tangent, but I think that was kind of a needed to be said kind of thing.
I just want to add one more thing to that.
Yeah, go for it.
So if you study the work of Dr. David Getoff, he had an anecdote that he was telling about in a class one time, and he was talking about cancer patients, and he was looking at cancer patients' pH. And what he found strikingly was that the cancer patient's pH was surprisingly alkaline. And what the hypothesis and kind of what the verdict was, according to him, was that the reason why it's alkaline is because these cancer patients' ability to excrete acids are impaired. So it was more of an impairment that they weren't getting the acids out of their body, and it was affecting them. So just the fact that you may have an alkaline pH in your urinary system may be a sign that you're also not excreting the acids out properly too.
So if somebody tells you cancer cannot survive in an alkaline environment, please tell them that people can have cancer and have alkaline.
Yes, it's very possible.
Yeah. Okay.
Absolutely.
So get back to digestion. We talked about the functions of digestion. We also talked about the importance of our hydrochloric acid. So after that said, after that portion of our body, after it gets to our stomach and our body produces the bile salts and the hydrochloric acid and the different enzymes to break down the proteins, fats, it's going to get lower to the next portion. Could you talk about what's going to happen after that? There's two more sections in the body, so go for it.
Great. So what happens is we have all this food that's kind of ground up and mixed up, and this is called chyme. And this acidic chyme enters the small intestine, and if it's acidic enough, it triggers our gallbladder to release bile, and it triggers our pancreas to produce various enzymes such as trypsin, chymotrypsin, and lipase. So this starts more of the digestion with protein and more of the digestion with fat. And the really important thing here is the hormone that does this is CCK, or cholecystokinin. And this is really important because cholecystokinin actually feeds back to your brain and tells you you're full. So if we have good acidity in our gut, and then we produce enough CCK to stimulate our gallbladder to digest fat and protein, guess what happens to our appetite now?
I think we're feeling pretty good.
Yeah, exactly. And that's the big thing. It's going to be way harder for you to overeat when you have this nice, healthy symphony of hormones that feed back to the brain and tell you you're full.
Yeah, definitely.
Did you want to add something there, Barris?
Oh yeah, no. I just want us to keep going down the track down to the small intestines, and then what happens kind of in the small intestine, then to the colon, and then bam.
Got it. So then essentially what's happening next here is you have these various microvilli. They're like little finger-like projections in the small intestine. Think of them as like little vacuum cleaners. So if we have a lot of inflammation going on in our intestinal tract, like a gut infection or et cetera, this can affect our absorption of these little vacuum cleaners sucking up our nutrients, whether it's B vitamins, whether it's vitamin C, calcium, iron, all of these minerals. If those vacuum cleaners are clogged because of inflammation or because of autoimmunity, we're not going to be able to suck up those nutrients. And that's an important thing because people just make the automatic assumption, that you are what you eat, right?
Mm-hmm.
But that's not true. It's that you are what you eat, digest, utilize, assimilate, then absorb. So we have to make sure the absorption process is happening. So we need to make sure we have good gut functioning. And if we have a leaky gut, which is essentially the tight junctions in the gut. So if all our listeners could just put their hands together like they're saying a prayer, and if they look at the pads of their fingers or where they kind of interconnect, that's like the tight junctions in our gut. And when it's tight, it's good because all of the food gets broken down into its small constituents like glucose or amino acids or essential fatty acids. They get broken down small enough where they get, go through the liver and then they go into the bloodstream. The problem is if you pull your hands apart a little bit just so you see enough daylight, now those food particles don't get broken down all the way and they start going into our bloodstream. And from there, they can cross-react where they look like other proteins in the body, where dairy may cross-react with gluten or soy may cross-react with gluten or other things may cross-react with gluten. Or we may have some molecular mimicry where our immune system starts tagging the surface proteins on the food, and there's certain organ tissue like the thyroid in gluten, like bovine albumin in cow's milk and the pancreas. These things get tagged and the immune system starts attacking those foods, but then also in collateral damage starts attacking the thyroid or the pancreas or maybe even the brain, certain brain tissues too. So that's kind of the next step. Any questions about that?
So that's basically false identity. What's going on there? Your body sees something and says, hey, this got into our blood tract. It's not supposed to be there. Next time you see it, attack it. But the protein of it, like you said, the surface protein of it looks very similar to some other tissues, and that's basically what an autoimmune problem is, where you start to attack yourself, right? Where your immune system starts to attack its own organs.
Yeah, and a lot of people aren't aware of the fact that about 70 to 80% of our immune system is actually in our gut. So we have something known as the GALT, the gastric associated lymphoid tissue. That's in our stomach. And we have our MALT, which is our mucosal associated lymphoid tissue. And about 70 to 80% of our immune system's in our gut. So guess what happens to our immune system if we're constantly getting fired up because of simple things like foods?
Oh man, you're stressed out even when it's not mental emotional stress. If you're eating stuff and you're just firing off your immune system consistently, yeah, it's not a good thing.
Yeah, so like when we have people that have an immune system that's chronically fired off and being stressed, what happens is we get things like allergies because our body is just chronically thinking any little thing that comes in is a problem. So it's like, someone rings your doorbell and you go out there thinking it's a terrorist ready to attack, right?
Yeah.
There needs to be an appropriate response where, this dander, this pollen, it's not a virus or bacteria. Let's not, bring out the whole brigade and create a whole histamine reaction and an inflammatory reaction. So we get this hyper response, right? And then on the other side, if we totally weaken it, we can actually get things like cancer, where our body is not able to control cell growth in our body, and then cells start growing out of control. And then we get cancer. And then we have our immune system that gets, pretty strong as well. And that's where we have autoimmune conditions on the hyper side. And then our body starts attacking other tissues in our body as well. So it's this delicate balance. And when we talk about having a strong immune system, you could have a strong immune system and still have an autoimmune condition or allergies. It's about having an intelligent immune system. So a strong but intelligent immune system. So it appropriately mounts an attack against what's coming in.
Yeah, definitely. So we got a little bit of the overall how our body should operate, and we got even some things that we should know that can cause problems, like if we don't have enough hydrochloric acid, there's going to be issues. But could you talk quickly about gut bacteria? I think this is an important part that It's starting to get a lot more attention than before. Like I'm even seeing some mainstream media like mention, like probiotic supplements. They're usually like crap ones, but I'm seeing like it become recommended more often.
Yeah. So again, in our intestinal tract, we have a balance of bacteria, and the healthy person's gut's going to have more good bacteria than bad bacteria. So I kind of like the 80-20 rule. So 80% good stuff, 20% bad stuff. And what happens is we have, low hydrochloric acid, and we have leaky gut, and we potentially have other underlying infections in the gut that can predispose the amount of bad stuff in our gut in relation to good stuff. So think of that as a garden where the garden is now starting to be taken over with weeds. And the more weeds there are, the more those weeds actually crowd out the good, healthy plants you're trying to grow. So that's kind of what dysbiosis kind of refers to in the gut. And a lot of these dysbiotic bacteria, they produce toxins. They can produce endotoxin. They can produce something called LPS, which can actually further make your gut leaky. They can produce chemicals that actually slow down digestion, especially fungus toxins like mycotoxins. They can produce chemicals that slow down peristalsis. So imagine your intestinal tract like a toothpaste tube. And when you're trying to get the very end of the toothpaste out, you kind of roll it up to kind of push it along the toothpaste tube. Well, that's what happens in your gut, except we have these wave-like contractions, and those contractions are controlled by our brain. But when we have these toxins that are there, that kind of messes up the brain communication, and that basically decreases our body's ability to kind of act like a toothpaste container and push it out. So then that stool or that fecal material doesn't get eliminated in that 24-hour period, and then we start absorbing more toxins from our stool, which can make us even more sick. So it's like this downward cycle of dysbiosis, leaky gut, constipation, absorption of toxins, low stomach acid, inability to break down minerals, can't absorb amino acids, autoimmunity, molecular mimicry. It's like this really crazy tree with all these different tentacles of destruction coming off it, if you will.
Yeah, definitely. So what is that called? Endotoxicity, where you start to absorb your own toxins?
Yeah, it's actually called auto-intoxication.
Yeah.
Auto-intoxication. You are intoxicating yourself.
That was my next word.
Yeah, you're intoxicating yourself with things in your body. That's why elimination,
Is
anyone
important.
it's so important. Anyone listening right now, just go take a whole bunch of charcoal or go eat a whole bunch of beets, set the timer, and just look in the toilet for when you see, your stool go red if you're doing beets, or really, really black dark if you're doing charcoal, and then set the timer on it. If it goes longer than 24 hours, or if you have a history of just not having a bowel movement every day, then you are poisoning yourself.
Yeah, basically. And it's funny too because it's considered so common and so normal that oh yeah, I go like twice or 3 times a week, and it's like that's not normal. But neither is it to go like 5 times a day either. So
Yeah, I mean,
you don't want to have a hypermobile gut.
yeah, I actually wrote a blog about natural solutions for depression and anxiety. And it was known as far back as 1933 that our body's internal toxins can actually cause bouts of depression. And it's one of the great books. It was written, I think, in the 1920s. I'll read a quote from the book. The book was called The Conquest of Constipation, The Lazy Colon. And what the person wrote was, a burdening, fermenting, decomposing, putrefying, filling the body with poisonous substances and creating a sewer-like blood. That auto-intoxication is the cause of 90% of disease. One more time. Is the cause of 90% of disease, end quote, and the constipation shortens life. And this was talked about in the 1920s and 30s. There's a famous gastroenterologist named Mechnikov, and Mechnikov basically was, I think, quoted as saying, life and death starts in the colon.
Yeah, exactly. It's funny too because David Webster, who wrote the book Achieve Maximum Health, it's funny. It's like the book title is Achieve Maximum Health, so people are like, oh, I think and it's like about colon flora, the missing link in immunity, health, and longevity, and he talks about auto-intoxication as well. And dedicates a whole chapter to it.
Yeah, and part of the mechanism, I think, is when we have this amount of dysbiotic bacteria, there's a couple things. It basically affects how we break down and metabolize hormones. So if we're getting all these hormones in our environment, oh wait, pesticides, plastics, chemicals, right? These are all external synthetic hormones. It affects our body's ability to eliminate hormones. Also, the toxins in our gut also can affect our body's ability to break down certain amino acids like 5-HTP or tryptophan into serotonin. And it also can affect breaking down L-tyrosine or L-phenylalanine into dopamine. So if we have a lot of these bad critters in our tummy, that can affect our bodies taking these proteins and creating them and converting them into healthy neurotransmitters. That's why lots of people, when you fix their gut and you start getting these things addressed, they start feeling better. Their disposition gets better. And the reason is, if you read the book called The Second Brain, forget the person who wrote it, but he was a gastroenterologist over at Columbia, and he basically, did the research showing that 95% of serotonin is actually produced in the gut. So healthy gut balance is super, super important just for mental health. And I know that's like so weird for people to wrap their head around because you're like, what, gut? And there's that old saying like gut instinct, right? I mean, there's definitely that brain-gut axis type of connection. And people kind of intuitively knew it. It's true. It's definitely out there, and the science supports it.
Yeah, definitely. So have a happy poop, right? Have a happy bowel movement in the morning.
Yeah, exactly.
So I know we've taken this whole podcast more to talk about just the basics kind of thing, and we can probably go on and on. We'll probably make a series out of this one just because there's so many different individual digestive issues. The same thing with the thyroid. We're going to go into a series with this one as well. And this is kind of going to be like part one, the basics. But let's just talk about, I guess, some basic things somebody can do. Just because if I want someone to hear this, they have a lot of basic knowledge, but maybe they might have an upset stomach or what's a good one, or constipation. Let's help somebody out there. And then what can they do to help make their stomach feel better, or make sure that they're having a bowel movement regularly, not every 36 hours, right?
Right. Well, the first thing I would make sure that the diet is, and this is kind of all, I mean, when you look at functional medicine, the foundation is diet, right? So if you're going to build like a big skyscraper, the taller the skyscraper is, the deeper you actually have to go into the ground, the stronger the foundation has to be. So the more problems someone has with their health, the more you have to work on the foundation. So the foundation in functional medicine is always diet and lifestyle. So ideally having a good anti-inflammatory, nutrient-dense, low-toxin diet, and paleo diet's a really good approach. Bulletproof diet, GAPS, these are all really good approaches to kind of start. And depending on where someone is that I see in my clinic, they could have gut infections, they could have autoimmunity, it could be going on for decades. So it really depends. You may even an autoimmune paleo diet. So it really depends on kind of how long the problems have been going on and how severe. Some people just shifting their diet alone can make all the difference. Some people, they have to add in hydrochloric acid and or enzymes. Some people have a gut infection that's preventing them from fully healing. So there's like a wide spectrum, but the best thing anyone can do off the bat, just kind of Reader's Digest knowledge here, is just make sure your diet's anti-inflammatory, nutrient-dense, low toxins, and that could be a paleo or an autoimmune paleo type of approach. And then from there, if you're still having issues, looking deeper and maybe getting some gut testing done, maybe the next step to see if you have a small intestinal bacterial overgrowth, to see if you have fungal, bacterial, or parasitic type of infection. These are good next steps to make sure there's no issue there. And also people going on a low carbohydrate diet, and some people may need to do that because they're metabolically damaged, they're just more insulin resistant, and they may need to go on a low carbohydrate diet. And what the research is showing is certain bacteria in the gut that actually decrease when you go on a low carbohydrate diet. And these bacteria are the Roseburia bacteria or the Erectali bacteria. And these bacteria, kind of like in the stomach, they actually keep the pH in our gut lower. So when our pH is a little bit lower in our intestinal tract, it makes it harder for bacteria to grow. And again, it also spits out more butyrate. And butyrate is the same fat found in butter. And this butyrate is really important because it actually feeds a lot of the good bacteria. It feeds the colonocytes. These are certain cells in the intestinal tracts, in the colon, for instance. And what happens with certain people as their gut gets thrown more off balance, there's a phenomenon known as SIBO, where bacteria from the colon will actually migrate back upwards into the small intestine. And we kind of talked about how HCl is really important for kind of clamping down.
Real quick for people, SIBO, small intestinal bacterial overgrowth. That's what that stands for. Go ahead. Yeah.
So we kind of talked about I'm going to kind of make a connection with the stomach and the intestinal tract. So we talked about in the stomach that hydrochloric acid and bacteria is really important. If they go out of whack, then our colon or our esophagus becomes weaker, and that sphincter starts opening up and acid can kind of rise upward. So that's really important that that's tight. The same thing that happens in our intestinal tract, where our colon meets our small intestine, if we don't have enough good quality butyrate in a low pH, that sphincter, it's called your iliosphincter or your ileocecal valve, can get loose, and then bacteria comes back from the colon into the small intestine, and that can create a whole bunch of problems and create all kinds of digestive issues.
Yeah, definitely. So real quick before we finish up this call, and like I said, we kind of switched it up. I almost forgot for a second like how deep we were just going to get into like kind of the basics. But so real quickly, do we have like some, and you mentioned like the butyrate, how it feeds good bacteria. So I'm thinking to myself, oh, we should definitely tell people, make sure that you're getting really high quality butter in your diet. Are there any other really high quality, or I don't want to really use a term, but any superfoods or any herbs that that will be like very healing to somebody that might have these issues?
Yeah, so you can also add in resistant starch. So resistant starch is resistant starch type 3, which is like the potato starch. Bob's Red Mill makes a really good one. You can add this in 1 to 2 tablespoons at breakfast, some water. I'm also experimenting right now with ripe bananas that are ground up into a powder. And I'm doing this just because they're lower glycemic and they're more autoimmune friendly, because potatoes kind of off the autoimmune diet. So I'm experimenting with ripened bananas that are ground up into a powder form. And this is a resistant starch type 2. And this can feed some of that Roseburia/E. rectali bacteria that can increase the butyrate, that can decrease the pH in the gut, and make a nice friendlier environment in the gut. So that's something that you can do. And I don't think we really touched upon the IBS diagnosis. So just to kind of put that out there, essentially what IBS is, it's a diagnose, meaning I don't know. In medicine, it's called a diagnosis of exclusion. Meaning we've ruled out this disease, we've ruled out Barrett's esophagus, we've ruled out ulcerative colitis, we've ruled out Crohn's, we've ruled out IBD, we've ruled out all these other conditions that could be happening, celiac, the whole 9 yards, H. pylori infections, and we still don't know what the problem is. So that's all IBS means. It means that you have problems, you don't feel good, your gut's, on the fritz, and your medical doctor saying, we just don't know what's causing it.
And looking at the literature, I'm pretty sure a lot of, because you mentioned SIBO, a lot of IBS, and again, IBS is irritable bowel syndrome. I don't want to mess up the number, but I think it's upwards of almost 80% could be SIBO, if I'm not mistaken.
Yeah, and people that have SIBO benefit making more subtle changes in the diet on top of paleo, so it gets more nuanced. So we'll probably have to save those changes for a second type of podcast that goes a little bit deeper on these topics.
Definitely. Yeah, that sounds good. So thank you guys for taking the time to listen. We'd really appreciate it if you guys went to iTunes and left us a 5-star rating. You can leave us whatever rating, but 5 stars will be even better appreciated. Share this with your friends, families. If you know anybody who has digestive issues, definitely share this with them. And if you want more information, go to beyondwellnessradio.com. We are always looking for questions from you guys. We love hearing back from you. So if you do have questions, you can go to beyondwellnessradio.com/question, and you can just shoot us a line. And if you need to work with us as patients, we can also take you from there as well. So definitely awesome podcast, like always, Dr. Justin.
Yeah, the podcast has been great. Hopefully, most people will enjoy the brain candy.
Oh yeah, definitely. Okay, everybody, you have a good one, and we'll hear from you next time.
Thanks, Barris.
Perfect. That sounded good.
All right. And that sphincter starts opening up and acid can kind of rise upward.
Mm-hmm.
So that's really important that that's tight. The same thing that happens in our intestinal tract where our colon meets our small intestine, if we don't have enough good quality butyrate and a low pH, that sphincter, it's called your iliosphincter or your ileocecal valve, can get loose, and then bacteria comes back from the colon into the small intestine, and that can create a whole bunch of problems and create all kinds of digestive issues.
Yeah, definitely. So real quick before we finish up this call, and like I said, we kind of switched it up. I almost forgot for a second like how deep we were just going to get into like kind of the basics. But so real quickly, do we have like some, and you mentioned like the butyrate, how it feeds good bacteria. So I'm thinking to myself, oh, we should definitely tell people, make sure that you're getting really high quality butter in your diet. Are there any other really high quality, or I don't want to really use the term, but any superfoods or any herbs that that will be like very healing to somebody that might have these issues?
Yeah, so you can also add in resistant starch. So resistant starch is resistant starch type 3, which is like the potato starch. Bob's Red Mill makes a really good one. You can add this in 1 to 2 tablespoons at breakfast, some water. I'm also experimenting right now with ripe bananas that are ground up into a powder. And I'm doing this just because they're lower glycemic and they're more autoimmune friendly, because potatoes kind of off the autoimmune diet. So I'm experimenting with ripened bananas that are ground up into a powder form. And this is a resistant starch type 2. And this can feed some of that Roseburia/E. bacteria that can increase the butyrate, that can decrease the pH in the gut, and make a nice friendlier environment in the gut. So that's something that you can do. And I don't think we really touched upon, the IBS diagnosis. So just to kind of put that out there, essentially what IBS is, it's a diagnose meaning I don't know. In medicine, it's called a diagnosis of exclusion. Meaning we've ruled out this disease, we've ruled out Barrett's esophagus, we've ruled out ulcerative colitis, we've ruled out Crohn's, we've ruled out IBD, we've ruled out all these other conditions that could be happening, celiac, the whole 9 yards, H. pylori infections, and we still don't know what the problem is. So that's all IBS means. It means that you have problems, you don't feel good, your gut's, on the fritz, and your medical doctor saying, we just don't know what's causing it.
And looking at the literature, I'm pretty sure a lot of, because you mentioned SIBO, a lot of IBS, and again, IBS is irritable bowel syndrome. I don't want to mess up the number, but I think it's upwards of almost 80% could be SIBO, if I'm not mistaken.
Yeah, and people that have SIBO benefit making more subtle changes in the diet on top of paleo, so it gets more nuanced. So we'll probably have to save, those changes for a second type of podcast that goes a little bit deeper on these topics.
Definitely. Yeah, that sounds good. So thank you guys for taking the time to listen. We'd really appreciate it if you guys went to iTunes and left us a 5-star rating. You can leave us whatever rating, but 5 stars will be even better appreciated. Share this with your friends, families. If you know anybody who has digestive issues, definitely share this with them. And if you want more information, go to beyondwellnessradio.com. We are always looking for questions from you guys. We love hearing back from you. So if you do have questions, you can go to beyondwellnessradio.com/question, and you can just shoot us a line. And if you need to work with us as patients, we can also take you from there as well. So definitely awesome podcast, like always, Dr. Justin.
Yeah, the podcast has been great. Hopefully most people will enjoy the brain candy.
Oh yeah, definitely. Okay, everybody, you have a good one, and we'll hear from you next time.
Thanks, Barris.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.